Question 1. In the context of nuclear medicine, what should the primary concern be when considering a patient undergoing a radioactive iodine therapy procedure for hypothyroidism? A. Ensuring the patient receives adequate hydration throughout the treatment. B. Confirming the patient's thyroid function is within normal limits prior to the procedure. C. Verifying that the patient has no allergies to the radiopharmaceutical used. D. Ensuring the patient understands the potential long-term effects of radiation exposure. Answer. Correct answer. D. Ensuring the patient understands the potential long-term effects of radiation exposure. Explanation. When administering radioactive iodine therapy, patient education on the long-term effects of radiation is crucial. Patients must be informed about the potential risks, including the possibility of thyroid gland dysfunction or cancer. This aligns with the ethical responsibility of ensuring informed consent NMAA Standard 3.3. Although hydration and confirming thyroid function are important, they are secondary to educating the patient about radiation exposure risks. The focus on patient safety and ethics in the informed consent process is reinforced by regulatory guidelines and ethical standards in nuclear medicine. Question 2. Given the circumstances of a patient scheduled for a PET scan, which of the following is most important for the technologist to ensure? A. The patient has not eaten within 24 hours of the scan. B. The patient does not have any metal implants. C. The patient's blood glucose level is within normal range. D. The patient is wearing loose, comfortable clothing. Answer. Correct answer. C. The patient's blood glucose level is within normal range. Explanation. PET scans rely on the administration of radio-labeled glucose, and elevated blood glucose levels can lead to inaccurate imaging results due to the competitive uptake of glucose in non-cancerous tissues. According to NMAA guidelines, checking blood glucose prior to the procedure is essential to avoid diagnostic inaccuracies. NMAA Standard 6.5. While other considerations, such as the patient's dietary intake and clothing, are important, controlling blood glucose levels directly impacts the diagnostic quality of the scan and the safety of the procedure. Question 3. In light of recent developments in nuclear medicine, which of the following best describes the purpose of performing a quality control procedure on a gamma camera before a diagnostic imaging procedure? A. To ensure that the patient's exposure to radiation is minimized. B. To verify that the camera is producing high-resolution images without distortion. C. To ensure that the camera has been properly calibrated to detect all radiopharmaceuticals. D. To evaluate whether the patient is positioned correctly for imaging. Answer. Correct answer. B. To verify that the camera is producing high-resolution images without distortion. Explanation. Performing quality control on imaging equipment is essential for maintaining diagnostic accuracy. According to NMAA guidelines, gamma cameras must be routinely checked to ensure high-resolution image quality and to minimize image distortion. NMAA Standard 7.2. This step ensures that the images generated are clear, aid accurate diagnosis. Although radiation safety and proper calibration are important, quality control focuses on image fidelity, which directly impacts clinical outcomes. Positioning is also critical but falls under the patient preparation aspect. Question 4. Considering the evidence of radiation exposure risks, how should a nuclear medicine technologist handle the administration of a radiopharmaceutical to a pregnant patient? A. Ensure the patient signs a consent form acknowledging the risks. B. Use the lowest effective dose and closely monitor the patient. C. Recommend that the patient undergo alternative imaging procedures. D. Proceed with the administration as radiopharmaceuticals are safe during pregnancy. Answer. Correct answer. B. Use the lowest effective dose and closely monitor the patient. Explanation. For pregnant patients, minimizing radiation exposure is paramount. The NMAA guidelines emphasize the need to balance diagnostic benefit with the risks associated with radiation. NMAA Standard 8.4. If no alternatives are available, the technologist should administer the lowest effective dose and ensure appropriate monitoring. It is critical to evaluate the risks and consider alternative methods, but consent and cautious administration remain the primary actions. Radiopharmaceuticals should never be deemed safe during pregnancy without thorough risk assessment. Question 5. In response to an unexpected adverse reaction to a radiopharmaceutical, what should the nuclear medicine technologist prioritize in managing the patient's care? A. Immediately document the reaction and report it to the physician. B. Administer life-saving interventions as needed, following institutional protocols. C. Contact the patient's family to provide support and reassurance. D. Wait for the patient to stabilize and then reassess the situation. Answer. Correct answer. B. Administer life-saving interventions as needed, following institutional protocols. Explanation. In the case of an adverse reaction, the technologist's primary responsibility is to provide immediate intervention based on established protocols NMAA Standard 10.1. This could include basic life support (BLS) or advanced life support (ALS) depending on the severity of the reaction. Documenting and reporting the incident necessary, but the immediate priority is patient stabilization. The involvement of the family may be important later, but patient care must take precedence. Question 6. What is the most significant factor in determining whether a patient can undergo a nuclear medicine stress test procedure? A. The patient's overall physical condition and ability to tolerate exercise. B. The patient's medical history of cardiovascular disease. C. The presence of allergies to contrast media. D. The availability of trained personnel to administer the test. Answer. Correct answer. A. The patient's overall physical condition and ability to tolerate exercise. Explanation. Nuclear medicine stress test evaluates cardiovascular function, and the patient's physical ability to safely undergo exercise is critical. According to NMAA guidelines, Standard 5.3, patients should only be subjected to stress testing if they are capable of performing the required exercise or if pharmacologic stressors are utilized. While medical history, allergies, and personnel training are important, physical condition is the primary determining factor for patient eligibility for this procedure. Question 7. Under the assumption that a patient has consented to undergo a diagnostic procedure involving a radiopharmaceutical, which of the following steps is the next most critical? A. Verifying the specific radiopharmaceutical to be used in the procedure. B. Confirming the patient's dietary restrictions before the procedure. C. Providing post-procedure instructions to the patient. D. Ensuring the radiopharmaceutical dose is appropriate based on patient weight. Answer. Correct answer. A. Verifying the specific radiopharmaceutical to be used in the procedure. Explanation. The most critical step before administering a radiopharmaceutical is to confirm the correct substance and dosage for the procedure, ensuring both accuracy and safety. NMAA Standard 6.1. This step prevents errors in medication administration and ensures that the procedure will be effective. While confirming dietary restrictions and post-procedure instructions are important, they occur after the proper verification and preparation of the radiopharmaceutical. Question 8. To what extent does the use of a PET scan improve the accuracy of diagnosing certain cancers? A. It provides the same level of accuracy as other imaging modalities, such as CT scans. B. It provides significantly better resolution for detecting tumors in areas with high metabolic activity. C. It is particularly effective for diagnosing bone-related cancers, but less so for soft tissue tumors. D. Its primary benefit lies in detecting benign conditions rather than malignant tumors. Answer. Correct answer. B. It provides significantly better resolution for detecting tumors in areas with high metabolic activity. Explanation. PET scans are highly effective in detecting cancers, particularly those with high metabolic activity like lymphoma and some solid tumors. NMAA Standard 6.3. Unlike ET or MRI, which provide anatomical information, PET scans provide functional data, helping to identify active cancerous tissue. In the early stages, this increased sensitivity makes PET superior for certain cancers, especially in detecting distant metastases or recurrent disease. Question 9. The primary reason for utilizing a gamma camera for nuclear medicine imaging procedures is to A. Provide high-quality structural imaging to guide surgery. B. Detect and localize radiation emitted from radiopharmaceuticals within the body. C. Measure the exact dose of radiation a patient has received during the procedure. D. Assess the patient's overall condition during the imaging procedure. Answer. Correct answer. B. Detect and localize radiation emitted from radiopharmaceuticals within the body. Explanation: gamma cameras are specifically designed to detect gamma radiation emitted from radiopharmaceuticals inside the body. NMAA Standard 6.7. This functional imaging capability allows for the visualization of physiological processes, aiding in the diagnosis of a variety of conditions, including cancer, bone diseases, cardiovascular issues. It is not primarily used for structural imaging, dose measurement, or general patient assessment. Question 10. When considering a patient's medical history, which factor is most important when determining eligibility for radiopharmaceutical administration procedure? A. The patient's ability to tolerate pain during the procedure. B. The presence of any conditions that might contraindicate the use of specific radiopharmaceutical. C. The patient's insurance coverage for the procedure. D. The patient's familiarity with the procedure from previous experiences. Answer. Correct answer. B. The presence of any conditions that might contraindicate the use of a specific radiopharmaceutical. Explanation: a comprehensive medical history review is crucial to identify contraindications, such as allergies or organ dysfunction, that could affect the safe use of radiopharmaceuticals. NMAA Standard 4.1. Conditions like kidney disease or thyroid dysfunction can alter the body's response to radiopharmaceutical or affect the imaging process, making this factor the most important consideration. The patient's pain tolerance and insurance coverage are secondary concerns, and prior experience is not primary determining factor for eligibility. Question 11. Which of the following actions should a nuclear medicine technologist take when administering a radiopharmaceutical to a patient with a known allergy to iodine-based contrast agents? A. Administer the radiopharmaceutical as planned, as it does not contain iodine. B. Delay the procedure and consult with the physician to determine if an alternative radiopharmaceutical is needed. C. Administer the radiopharmaceutical with an antihistamine to counteract any potential allergic reactions. D. Proceed with the procedure but inform the patient of the possible risk without any further actions. Answer. Correct answer. B. Delay the procedure and consult with the physician to determine if an alternative radiopharmaceutical is needed. Explanation: in the context of a known allergy to iodine-based contrast agents, it is important to evaluate potential risks associated with the use of radiopharmaceuticals. Although iodine-based contrast agents and radiopharmaceuticals are different substances, there could be cross-reactivity or hypersensitivity concerns. The technologist should consult with the physician to explore alternative radiopharmaceuticals or adjust the plan accordingly, ensuring patient safety. Guideline: ACA Manual on Contrast Media 2021. Question 12. Mr. Thompson is undergoing a bone scan. During the procedure, he complains of feeling nauseous and dizzy. What should the technologist do? A. Continue the procedure, as nausea and dizziness are common side effects of the procedure. B. Stop the procedure immediately and call for medical assistance, as the symptoms could indicate a serious reaction. C. Provide Mr. Thompson with water to help alleviate the symptoms and proceed with the scan. D. Offer Mr. Thompson anti-nausea medication and resume the procedure. Answer. Correct answer. B. Stop the procedure immediately and call for medical assistance, as the symptoms could indicate a serious reaction. Explanation: nausea and dizziness could be signs of an adverse reaction to the radiopharmaceutical or the procedure itself. The technologist should stop the procedure immediately and seek medical assistance. It is crucial to monitor for any potential complications, including anaphylaxis or other serious side effects, and appropriate intervention based on the severity of the symptoms. Regulation NRC guidelines on radiation safety. Question 13. Which of the following is a critical factor to evaluate before performing a cardiac stress test on a patient with a known history of coronary artery disease (CAD)? A. The patient's current physical activity levels. B. The patient's weight and height. C. The patient's most recent cholesterol levels. D. The patient's ability to tolerate exercise or pharmacological stress agents. Answer. Correct answer. D. The patient's ability to tolerate exercise or pharmacological stress agents. Explanation: in patients with coronary artery disease, it is essential to evaluate their ability to tolerate stress testing procedures, whether exercise or pharmacologically induced. This consideration ensures that the patient can safely undergo the procedure without undue risk of exacerbating their condition. Factors like physical fitness, medications, prior cardiac events should be reviewed to determine the most appropriate test. Guidelines on stress testing. Question 14. Under the assumption that a patient has undergone an iodine 131 therapy session, what post-procedure care should the nuclear medicine technologist prioritize? A. Administer a second dose of radiopharmaceutical to improve the treatment's efficacy. B. Advise the patient to increase fluid intake and use toilet frequently to flush out radiation. C. Ensure that the patient avoids any form of physical activity for at least 72 hours. D. Instruct the patient to stay in isolation for 48 hours without any external contact. Answer. Correct answer. B. Advise the patient to increase fluid intake and use the toilet frequently to flush out radiation. Explanation. After iodine 131 therapy, the technologist should prioritize patient hydration to promote the excretion of the radiopharmaceutical through urine. Increased fluid intake and frequent urination help reduce the radiation dose to other organs, particularly the bladder. Isolation and avoidance of physical activity are generally unnecessary unless specifically required by the treating physician. Nuclear Medicine Safety Standards (LC). Question 15. Which of the following is the most appropriate action when a patient undergoing a nuclear medicine procedure expresses concerns about the radiation exposure? A. Reassure the patient by stating that radiation exposure is minimal and poses no risk. B. Provide a detailed explanation of the radiation safety measures and the benefit-risk ratio of the procedure. C. Inform the patient that the procedure is mandatory and they have no choice but to proceed. D. Tell the patient to consult with their physician for further explanation and avoid addressing their concerns. Answer. Correct answer. B. Provide a detailed explanation of the radiation safety measures and the benefit-risk ratio of the procedure. Explanation. The technologist should address the patient's concerns by explaining the radiation safety protocols in place, the benefit-risk ratio of the procedure, and the minimal exposure risks involved. Clear communication is essential to ensure informed consent and alleviate anxiety. Patients should understand why the procedure is necessary and how the radiation exposure is carefully controlled. Informed Consent Guidelines (NRE). Question 16. What should a nuclear medicine technologist do if they notice an issue with the quality control of the imaging equipment, such as incorrect calibration or a malfunctioning component? A. Continue the imaging procedure and document the issue for later review. B. Immediately stop the procedure and notify the supervisor or clinical engineer to address the issue. C. Attempt to fix the equipment issue independently before continuing with the procedure. D. Ignore the issue if the image quality is not visibly affected. Answer. Correct answer. B. Immediately stop the procedure and notify the supervisor or clinical engineer to address the issue. Explanation. Equipment malfunctions or incorrect calibration can compromise image quality and patient safety. The technologist should stop the procedure immediately and notify the appropriate personnel to repair the equipment. Continuing with the procedure could lead to inaccurate results and potential harm to the patient. Open Quality Control Guidelines. Question 17. During a procedure, a patient has an allergic reaction to the radiopharmaceutical. What is the most appropriate course of action? A. Monitor the patient closely without intervention, as allergic reactions are rare and usually mild. B. Administer antihistamines and continue the procedure as planned. C. Stop the procedure, call for immediate medical assistance, and follow the institution's emergency protocol. D. Inform the patient about the reaction and proceed with caution. Answer. Correct answer. C. Stop the procedure, call for immediate medical assistance, and follow the institution's emergency protocol. Explanation. If patient experiences an allergic reaction to the radiopharmaceutical, the technologist must stop the procedure immediately. The patient's safety is the priority, and appropriate emergency measures, including calling medical assistance, should be taken. It is critical to follow institutional protocols for reverse reactions to medications and contrast agents. NRC and ACA radiation safety protocols. Question 18. Mr. Wilson is receiving a PET scan for suspected malignancy. The physician orders the use of fluorodeoxyglucose (FDG). What should the technologist ensure before administering FDG? A. Verify that the patient has fasted for at least 12 hours to optimize FDG uptake. B. Confirm that the patient is not pregnant or breastfeeding. C. Ensure that the patient is well hydrated before administering the radiopharmaceutical. D. Confirm the physician's order and proceed without any further patient preparation. Answer. Correct answer. A. Verify that the patient has fasted for at least 12 hours to optimize FDG uptake. Explanation. For optimal FDG uptake during a PET scan, it is crucial for the patient to fast for at least 2 hours before the procedure. This reduces the influence of recent glucose intake on the imaging results, improving the accuracy of the scan. The technologist should also check for pregnancy or breastfeeding, but remains the most important preparatory step. NMAA practice guidelines for PET imaging. Question 19. What should a nuclear medicine technologist do if a patient presents with a history of renal impairment prior to a radiopharmaceutical injection? A. Proceed with the injection, as renal impairment is unlikely to affect the outcome of the procedure. B. Consult with the physician to determine if a low dose of radiopharmaceutical is needed. C. Administer a larger dose to account for the impaired renal function. D. Delay the procedure indefinitely until the patient's renal function is normalized. Answer. Correct answer. B. Consult with the physician to determine if a low dose of radiopharmaceutical is needed. Explanation. Patients with renal impairment may have difficulties eliminating the radiopharmaceutical from their system, increasing the potential for prolonged radiation exposure and side effects. The technologist should consult with the physician to adjust the dosage accordingly, ensuring safe and effective imaging. Nuclear medicine safety standards. Question 20. In the context of radiation protection, which of the following is the most effective method to minimize exposure to radiation for both patients and technologists? A. Use the ALARA as low as reasonably achievable principle by minimizing exposure time, maximizing distance, and using shielding. B. Limit patient contact and perform procedures without any protective measures as the radiation exposure is minimal. C. Only apply shielding for patients but not for technologists as their exposure is negligible. D. Rely on continuous monitoring devices to track exposure levels instead of FOB safety protocols. Answer. Correct answer. A. Use the ALARA as low as reasonably achievable principle by minimizing exposure time, maximizing distance, and using shielding. Explanation. The ALARA principle is the cornerstone of radiation protection in nuclear medicine. This principle emphasizes reducing radiation exposure by minimizing exposure time, increasing distance from radiation sources, and using appropriate shielding. These methods help protect both patients and healthcare workers from unnecessary radiation. NRC Radiation Protection Guidelines. Question 21. A nuclear medicine technologist notices that a patient's intravenous line is dislodged during the administration of a radiopharmaceutical. What is the best course of action? A. Continue the procedure and attempt to reinsert the line while administering the radiopharmaceutical. B. Immediately stop the procedure and notify the physician or medical team to address the situation. C. Administer the radiopharmaceutical through an alternative route if possible and proceed. D. Complete the procedure and document the issue as this is a minor issue. Answer. Correct answer. B. Immediately stop the procedure and notify the physician or medical team to address the situation. Explanation. If an intravenous line is dislodged during the administration of a radiopharmaceutical, the technologist should stop the procedure immediately. Administering the radiopharmaceutical through an improper or non-function would lead to inaccurate results or harm the patient. The medical team should be notified to resolve. Issue appropriately NRC guidelines on patient safety. Question 22. What should be done if a patient exhibits signs of distress such as shortness of breath during a stress test with a pharmacological agent? A. Increase the dose of the pharmacological agent to ensure accurate results. B. Stop the procedure immediately and notify the medical team for further evaluation and management. C. Continue with the test as the symptoms are common and temporary. D. Give the patient supplemental oxygen and proceed with the test. Answer. Correct answer. B. Stop the procedure immediately and notify the medical team for Further evaluation and management. Explanation. If a patient shows signs of distress during a pharmacological stress test, such as shortness of breath, the procedure should be stopped immediately. The technologist should notify the medical team as these symptoms may indicate a serious reaction such as myocardial ischemia or another adverse event. Immediate evaluation is required across guidelines for stress testing. Question 23. Which of the following actions is necessary when using a PET scan with a radiopharmaceutical such as FDG to assess a patient's cancer status? A. Ensure the patient has fasted for at least 4 hours prior to the procedure. B. Verify that the patient has no history of diabetes or hypoglycemia. C. Confirm that the patient has been fasting for at least 2 hours prior to the procedure. D. Administer glucose intravenously to the patient before the scan. Answer. Correct answer. C. Confirm that the patient has been fasting for at least 2 hours prior to the procedure. Explanation. Fasting for 2 hours before PET scan with FDG is necessary to optimize radiopharmaceutical uptake and reduce interference from circulating glucose. This ensures more accurate imaging of areas with high metabolic activity, such as tumors. Acrastro guidelines for PET imaging. Question 24. What is the best course of action if a patient is experiencing an allergic reaction to the contrast agent during A. Can A. Administer a sedative to calm the patient and continue with the procedure? B. Stop the procedure immediately and call for medical assistance. C. Continue the procedure and provide the patient with water to reduce the reaction. D. Switch to a different contrast agent and resume the procedure. Answer. Correct answer. B. Stop the procedure immediately and call for medical assistance. Explanation. If a patient shows signs of an allergic reaction to contrast, the procedure should be stopped immediately. The technologist should call for medical assistance to manage the reaction appropriately. Patient safety is paramount and allergic reactions can range from mild to life-threatening. ACA contrast media safety guidelines. Question 25. When performing a SPECT scan, which factor most influences the quality of the image produced? A. The patient's age and medical history. B. The dose and timing of the radiopharmaceutical administered. C. The ambient temperature of the imaging room. D. The speed of the camera rotation. Answer. Correct answer. B. The dose and timing of the radiopharmaceutical administered. Explanation. In SPECT imaging, the quality of the resulting image is highly influenced by the dose of the radiopharmaceutical and the timing of its administration relative to the scan. These factors directly affect the distribution of the radiopharmaceutical in the body, impacting the image's clarity and accuracy. SPECT imaging protocol SMMI. Question 26. Which of the following should a technologist consider when preparing a patient for a HICI with a contrast agent, particularly in patients with a history of kidney disease? A. Perform the scan with a low-dose contrast agent to minimize renal stress. B. Withhold the contrast agent and proceed with the scan without it. C. Administer the contrast agent slowly to reduce renal burden. D. Ensure the patient is well hydrated and monitor renal function post-procedure. Answer. Correct answer. D. Ensure the patient is well hydrated and monitor renal function post-procedure. Explanation. For patients with a history of kidney disease, it is important to ensure adequate hydration prior to the scan to support kidney function and reduce the risk of contrast-induced nephropathy. The technologist should also monitor renal function after the procedure. ACASPR Manual on Contrast-Induced Nephropathy. Question 27. What should a technologist do if a patient undergoing a radiopharmaceutical procedure is found to be pregnant or potentially pregnant? A. Proceed with the procedure as radiopharmaceuticals are generally safe during pregnancy. B. Delay the procedure until after the pregnancy is confirmed or the risk is assessed. C. Inform the patient that the procedure can proceed as normal, but the dose will be adjusted. D. Perform the procedure only if the patient is in the first trimester of pregnancy. Answer. Correct answer. B. Delay the procedure until after the pregnancy is confirmed or the risk is assessed. Explanation. Radiopharmaceuticals compose risks to a developing fetus, particularly in the first trimester. If pregnancy or potential pregnancy is confirmed or suspected, the procedure should be delayed and a risk assessment should be conducted. NRC safety standards and ACA radiation safety guidelines. Question 20. Which of the following is a common side effect of a radiopharmaceutical injection during a bone scan? A. Temporary redness or irritation at the injection site. B. Severe allergic reaction leading to anaphylaxis. C. Nausea and vomiting immediately following injection. D. Short-term dizziness and lightheadedness. Answer. Correct answer A. Temporary redness or irritation at the injection site. Explanation. One of the most common side effects of radiopharmaceutical injections, particularly during a bone scan, is localized redness or irritation at the injection site. This is typically mild and resolves on its own. However, severe reactions such as anaphylaxis are rare. ACA guidelines on radiopharmaceutical safety. Question 29. When a patient is receiving a whole-body scan using a PET combination scanner, what is the most important factor to ensure optimal image quality? A. The patient remains still throughout the procedure to avoid motion artifacts. B. The scan is completed as quickly as possible to minimize patient discomfort. C. The radiopharmaceutical is administered immediately before the scan to ensure the freshest imaging data. D. The patient's blood pressure is stable during the scan. Answer. Correct answer A. The patient remains still throughout the procedure to avoid motion artifacts. Explanation. The most important factor for optimal image quality during a PET scan is ensuring that the patient remains still during the procedure. Motion can cause significant artifacts in the images, making interpretation difficult. ACRASTRO practice guidelines for PET imaging. Question 30. Which of the following is the most effective method to reduce radiation exposure to healthcare workers during nuclear medicine procedures? A. Technologists should limit the number of patients they interact with during the day. B. Wearing a lead apron is the best way to protect the technologist from radiation exposure. C. Using shielding for both patients and technologists and adhering to the ALARA principle is the most effective method. D. Technologists should avoid wearing dosimeters to prevent exposure measurement. Answer. Correct answer. C. Using shielding for both patients and technologists and adhering to the ALARA principle is the most effective method. Explanation. To minimize radiation exposure to healthcare workers, it is essential to use proper shielding, lead aprons, barriers for both the patient and the technologist, and to follow the ALARA as low as reasonably achievable principle. This reduces unnecessary exposure and protects both staff and patients. NRC radiation safety guidelines.